Concussion is a brain injury. Over 300,000 sports-related concussions occur each year. About 1/4 of these injuries occur in high school athletes. Sport-related concussions are frequently missed or not managed properly. Failure to manage concussion properly can result in delayed recovery time and social and academic impairments. The athlete is more vulnerable to repeat injury during the recovery phase after a concussion. A second concussion may lead to long-term neurologic disability or even death. This is preventable simply by protecting the concussed athlete from repeat injury during the concussion recovery period. More commonly, acute concussion leads to a post-concussion syndrome, which can last for days and weeks and sometimes longer. Signs and symptoms of post-concussive syndrome include vacant stare, confusion, amnesia, disorientation, delayed verbal or motor response, inability to focus, headache, nausea or vomiting, visual disturbances, light sensitivity, disequilibrium, emotional instability, or dizziness and vertigo. Recent scientific studies have shown that individuals who have sustained a concussion are more vulnerable to sustaining a repeat concussion, particularly during the first week of recovery. Repeat concussions are known to recover more slowly and are associated with increased risk of long-term impairment of memory and thinking. Chronic traumatic encephalopathy, an illness that mimics Alzheimer's disease, afflicts many NFL players who have sustained multiple concussion injuries. Studies also show that younger athletes are more vulnerable to the effects of concussion injury and take longer to recover from concussion. Community awareness is the first step to effective concussion management. Besides the athlete, parents, coaches, faculty, and medical professionals must all be well informed and ready to participate in the athlete's care. Sportsmanlike conduct, conformity to the safety rules of the game, along with properly fitting protective equipment and other preventive technology, such as padded goalposts, must be prioritized by coaches, athletes, parents, and referees as a first step in the prevention of concussions. Athletes should be educated that protective gear does not make them invincible to the effects of impact in contact sports. It is extremely important that all involved must be able to recognize and report when the symptoms of concussion are present in effort to quickly identify the concussed athlete. A cultural shift in the community towards prioritizing recovery over return to play is a necessity. Coaches, parents, and the medical community should be on the same page when it comes to advising the young athlete of when it is appropriate to return to gameplay. In order to ensure proper care in the case of concussion, Excellent Brain Sport provides the Excellent Brain Sport Symptom Checklist and the Excellent Brain Sport COG performance test for baseline testing to establish the athlete's preseason levels of cognitive performance in order to optimally track recovery should a concussion occur. Excellent Brain Sport COG and the Excellent Brain Sport Symptom Checklist measure attention, memory, emotional state, and symptoms related to concussion injury. It is important that baseline performance is assessed prior to the season so that medical professionals can know when an injured athlete has completely recovered from concussion. The results of this testing are made available to the athlete and other appropriate participants with recommendations regarding follow-up evaluations should the baseline evaluation suggest concerns about symptoms or performance. During practice or gameplay, an athlete may sustain impact or jarring injury to the head. Signs and symptoms that a concussion may have occurred include loss of consciousness, headache, nausea, vomiting, changes in vision, double vision, dizziness, loss of balance, a vacant stare, and memory impairment. These symptoms may not present immediately. Symptoms of concussion may take minutes, hours, or days to appear. Although loss of consciousness is not a requirement for the diagnosis of concussion, it often occurs. An unconscious athlete should always be assumed to have sustained an injury to the neck and spine. The ABCs of life support should be assessed in the field. Helmets should not be removed from the unconscious athlete unless CPR needs to be administered. Certain red flag findings suggest that the injured player should be transported to the emergency room. These include loss of consciousness more than a minute, severe headache, headache with nausea and vomiting, lethargy, visual problems, confusion or agitation, progressive worsening of symptoms, or something's just not right. The decision to transport a concussed athlete is often influenced by the policies of the individual school systems. If not sent to the ER, the athlete must be assessed and observed on the sideline for at least 20 to 30 minutes. During this time, sideline orientation, memory, and balance testing is performed by coaches or sideline medical professionals such as athletic trainers. XLNTbrain Sport provides a sideline smartphone app to assist in identifying and reporting concussion injury. The concussion reporting app will guide the user in a step-by-step assessment of the potentially injured athlete. Once completed, this report is immediately distributed to the appropriate participants involved in the athlete's care. If a smartphone is not available, or if the signs and symptoms of concussion occur later, XLNTbrain Sport provides paper and pencil assessments or reporting through the XLNTbrain Sport website. The recommendations for a concussed athlete are rest, rest, and more rest. Except in special circumstances, the athlete should not return to gameplay or exertion on the same day of the injury. The XLNTbrain Sport Concussion Management Program provides the athlete, coaches, and medical professionals the latest peer-reviewed and evidence-based guidelines in a clear, easy-to-follow, step-by-step protocol to assess and track an athlete's recovery. The XLNTbrain Sport Concussion Tracker allows the appropriate people participating in the athlete's care to view where the athlete is in the recovery process and what are the next steps towards return to normal activity. Tracking begins with a repeat of the XLNTbrain Sport Cog performance test and the XLNTbrain Sport Symptom Checklist, which are compared to the preseason baseline evaluations to assess the degree of impairment due to injury. If the athlete is suffering from persistent concussion-related symptoms, then the XLNTbrain Sport Symptom Checklist is completed daily to track recovery back to baseline. The XLNTbrain Sport Concussion Tracker is updated immediately upon completion of the XLNTbrain Sport Symptom Checklists and XLNTbrain Sport Cog performance testing. At each step of the process, if the athlete is still displaying symptoms of concussion or impairment of cognitive performance, the athlete is considered to be still recovering from injury and is to remain at rest. Once the athlete returns to baseline symptom scores, the XLNTbrain Sport Cog performance testing is repeated to see if the cognitive function has returned to baseline. When both symptoms and performance have returned to baseline, the athlete is guided through a 5-day progressive return to full exertion. The level of exertion is advanced daily as long as the athlete remains at baseline on the daily symptom checklist. The performance testing is administered once more after full exertion to ensure that cognitive function is not compromised by the return to full exertion. If this final test remains at baseline, then the athlete may be considered for return to gameplay by a medical professional. Concussion should be considered a serious injury with the potential to produce both short and long-term neurologic consequences. Appropriate management of concussed athletes using the XLNTbrain Sport Concussion Management Program helps to guide the injured athlete back to normal activity and gameplay as efficiently and safely as possible. Concussion is a brain injury. Over 300,000 sports-related concussions occur each year. 140,000 of these occur in high school athletes. Concussion accounts for 10% of all high school sports injuries. Sports-related concussions are frequently missed or not managed properly. Symptoms of concussion can last for days or weeks. If mismanaged, recovery from concussion can be delayed and the athlete may be vulnerable to further injury. We are only now realizing the serious consequences that sports-related concussions may have on the young, developing brain. Excellent Brain Sport is a comprehensive system for the management of sports-related concussion, developed through 20 years of my experience in caring for concussed individuals, combined with the latest technological resources available in the field. Excellent Brain Sport features include educational activities for athletes, parents, coaches, and medical professionals, baseline testing for brain performance, smartphone-based Sideline assessment apps, immediate concussion reporting to all key participants, post-concussion performance testing, and the Excellent Brain Sport Concussion Tracker aimed at safely and efficiently returning the athlete to gameplay.